And we are now live.
You need to.
Yep.
This is Senate Appropriations, and we're taking up several bills that have been referred to us because we're coming in so late this afternoon and people have other schedules. We're going to have to sort of shrink our agenda for today. And I would like to take up two bills, H720 and H711, that are both on the agenda. And the first, H720, is an act related to the system of care for individuals with developmental disabilities. I imagine I am not unique in the fact that I have received many emails from families in support of this legislation and the need to really look at how we provide particularly housing arrangements that perhaps are better suited to individuals than some of the old arrangements that might have been put in place after the closure of state facilities. So welcome, Senator Lyons. I realize that perhaps this is not yours, but we'll take advantage as chair. I'm sure you can speak to what the bill does. I gather this would be under the that bump, the Medicaid bump, in terms of the system and what can be funded.
So this Senator Ginny Lyons, for the record, and the committee did work very hard on the bill, knowing that there's a strong advocacy for having some improved housing available and services available for folks with disabilities. I think that the fiscal note that you have is probably the best place to begin, and looking at what's included in the bill. And I would simply say our committee feels very strongly about moving forward as much as possible, both with the housing section as well as with the limited service position for planning and the work that individual would be doing, which includes some of the housing and residential planning piece. The other, I guess the tension that developed during the testimony was whether or not the legislature would have to give approval before the plan would go forward. And so we put language in that would have a report back to the legislature on that section. That's really the area of the greatest concern that was expressed.
By advocates or families?
Yes.
Okay.
They didn't want it to be stretched out and go through another session with an approval process. So we put in place a report back, and I think that was a policy decision that we made. Obviously, there's a significant amount of money in the bill, but I can only say that we fully support the bill as it has come to you for increase for an appropriation for folks under FMAP to continue the planning process, the planning grants, to have the steering committee in place, to put the limited service position in place for the residential program developer. So we're, that's probably.
So many of the individuals are being served with the community-based organization infrastructure, either through SSAs or DAs. Is that correct?
I didn't hear your first part of the question.
I said the individuals that are who are qualified for developmental services, IDDS, are being served either through SSAs or DAs. So this would be, that's where Vermont Care Partners is obviously representing that community-based provider structure.
Yes.
And this,
This is a long time coming for people who really have some significant needs for services, and we know that during the pandemic, they've been some of the ones who have been affected the greatest. So I am, I don't know, you are going to have to make the decision around FMAP coverage, but I think that seems appropriate.
well, this would be reimbursed, and I guess with Nolan, I need to ask you, under that under that
Second
construct of permissible uses, for those dollars to be invested in the system, this would be a permissible use,
As far as I understand it is,
and it's built around that premise.
yes, that's my understanding, that's how.
I guess my question, ultimately is, these are planning grants. And they do a lot of planning, but, will in fact, that I would like to know that when we,
When it's
not
over,
just
something's
planning,
gonna
but that
happen.
in fact, we will be.
That's exactly what the issue is about having the report come, a presentation come back to the committees of jurisdiction and the plans go forward. So that is exactly the concern that was expressed during testimony in our committee. So having the report in the,
That it won't be consumed by consultants, but will actually,
it won't be impinged by having to go through a whole nother legislative process for approval.
So I guess the question, we're funding the planning. I would assume that what we're doing is really trying to get the data necessary to determine what would be the size of the population, how that looks like from different regions of the state, what are the housing options, how many units you would be wanting to develop in partnership, but ultimately,
And the payment reform process, that would be considered in section 6. Standardized assessment utilized by Gale.
well, number 6 is a conflict-free case management, which is a
That's it.
topic of discussion. I know that
Yes.
the Disabilities Council, I guess, Sue
Right.
Aronoff, have been very concerned about how glacial that process, and we are out of compliance with that CMS requirement. On the other hand, the agencies are saying that because of their workload and, and I believe the former secretary, because of the strong feeling of the advocacy community about how long it's taken, are really saying, we want action and we would like to see something done. So I guess the question here is payment reform, and does this deal with the fact that we have a federal requirement that we're not complying with, and how we're going to bring ourselves, well, it says bring into federal compliance.
Bring into federal compliance, and then if you look at on page 11, the last little C, that is where the discussion landed in terms of having the department present proposed policy changes on or before February 1st, 2023.
So you took testimony from the advocacy community as well?
Yes.
I just wanted to ask because
Yeah,
I
no,
had conversations.
I don't have the list with me, but yeah, we certainly did. And as you have received numerous emails and messages about this, so have we.
Nice.
Yes,
When you
right.
talk about conflict-free case management,
That's a CMS federal requirement.
yes, but what exactly, who are the people that have the conflict? The caretakers and the person who has the disability?
The agency itself, so that the person who's determining the level of services is also not the provider of services, so that there is that conflict, it's a conflict of interest in terms of, I'm gonna define what you need and I'm gonna provide it. And that's what is part of the federal policy. And it's been in place, what, I think, for 5 years or more. And there was a lot of concern about it, and it's been postponed. And then last year, Secretary Smith basically said, I'm moving ahead, we're out of compliance, CMS, and then the agencies are saying, but we're depleted on our workforce, and how can you expect us to implement something of this complexity in this environment? And so that's why I'm asking, what's the status of it? So I see we have.
This would be the status of it.
Okay.
So this is the attempt to move things forward in a way that they haven't previously.
What you're asking
I think
for
Senator Sears wants to say something.
is an appropriation out of that special pot of money that came with the FMAP bump. And I believe there are 4 or 5 categories of eligible expenditures that were identified in that plan. And this would come under that, so that it's not carrying a specific appropriation. Okay, Senator Sears?
Yeah, I'm failing to understand the need for a residential program developer if we're only doing planning for a residential to develop housing and residential service pilot planning grants in at least 3 regions. I think that's all great, but I don't understand the need for the residential program developer. And I'm not clear on why we need 5 new positions in Dale to annually annual quality reviews to the designated agencies. Is that what you were just talking about, that we're out of compliance?
Yeah,
Because we
so-
don't review?
This is Teresa was trying to skinny out of the budget.
This is where Stephanie would come in handy, because she said you guys.
Yes, I believe that Representative Wood had put language into the budget saying out of the 10 positions created in Dale, 5 would be dedicated to this. And we did not fund all of the positions, and we also said we wanted them to have greater flexibility to provide review and surveillance to other residential arrangements.
Thank you for that.
That's the section 3 that
Section 4, I don't understand why we're creating a new position. Seems like it's the cart before the horse. Section 5, I have no problem with, but why do we need a residential program developer if we don't know we're developing programs? I don't understand that need for that position.
So I think in response to your question, we have several people here from Aging and Independent Living. I thought Bard, I thought you'd retired, but apparently you're still still there. I want you to know I still refer to Children's Integrated Services as it's the new CUPS program, but that's ancient history. And I guess we have Jennifer Garabedian, also from Dale. So can you bring us up to date? I realize we caught Senator Lyons sort of at the end of the day, and she wasn't planning to report this. But the question becomes one of, is this position something that you've supported? Why do you need it before you do the planning? Because it seems like it would be the resource you need after you plan, so you know what you're developing and where you're developing it. Or maybe it's not titled right. So I don't know who wants to respond to the question, Bard or Jennifer?
Jennifer, would you like to respond or shall I?
I mean, I tend to defer to you, Bard, but I can take I can take it if you'd like me to.
Well, I'll jump in and then Jennifer maybe correct anything or add anything. For the record, Bard Hill, I am principal assistant to the commissioner of Dale. So thanks for letting us jump in at kind of the last minute. So specific to this residential developer, this came out of House Human Services after extensive testimony from parents, guardians, other folks saying, we want some new residential alternatives and we want Dale to have a position to support the designated agencies, specialized service agencies, and others in developing those and developing relationships with the housing support people. I will say that is one approach to getting this job done, so to speak. But that's where it came from. Is that helpful?
Okay, so it's not, I guess, I understand where it came from. But the sequencing, it seems like, in fact, they want action now, and they and planning would come after the fact. But that's what we're struggling with in terms of why you would need that individual, or the extent to which we are almost. Are we really talking about implementation grants more than just the planning in a more theoretical way?
An excellent question. Thank you. So as I, having heard that testimony, what I perceived was this position, limited service position, was to support people in the planning and development, and that the grants themselves were planning and development, but not purchase or implementation. So this was sort of the front end planning of new residential alternatives, models that do not yet exist or do not yet exist in adequate number. And then the ongoing purchase and development, one option for some of the subsidies or subsidies of capital investment could be enhanced FMAP. That's been a conversation within Dale and AHS. And then ongoing support, a combination of room and board paid by the individual resident, and then that a caveat that they would be enrolled in a specialized program so that the service payments came from one of the existing Dale programs, in this case, developmental disabilities.
So
I just said a lot in a sentence. Does that help though?
It does. Now, one of the models, and I guess maybe it's fallen out of favor, was intentional communities. And we have one in Hardwick, Heartbeat. And and I visited, it's a lovely facility. There's a farm, there's all kinds of activities. They are involved in community activities. They go to school events and, local performances, etc. Would that be an example of models that you might consider, or are you talking about individual residents? I know that, I don't know if they still use the term, but we used to have a lot of therapeutic foster homes almost. And I think that raised the question about, you're not really in your own home, you're not, and many of those placements, in fact, are legacy from when Brandon closed, and many of the providers are aging out or no longer able to provide care or appropriate care, or this the connection and stimulation and so forth, that it's really important. So when you're talking about housing models, could you just give us is it all of the above?
I will try to summarize what I heard as pretty eloquent testimony from a number of parents, guardians, family members who are saying, I and my family member want a stable place to live where when a staff person leaves, the staff person leaves, not my family member. So the shared living model, which is like foster care, if somebody moves into my house, when I don't want them to live there anymore, for whatever reason, they have to leave. For many people, that's quite disruptive in terms of their social network, they give up their home. And if they move 100 miles away, they've essentially left their community behind. I'm channeling the testimony that I've seen this year. And so what people are asking for is stable residential housing where the staff come in and leave, as opposed to the person receiving services.
It's really a variation on the SASH model, sounds like, where you're providing those supports and services in the person's home.
And so people are, and in this case, these are licensed residential facilities overseen by our Division of Licensing and Protection under state licensing rule. 3 or more people who are unrelated receiving care kicks into a license where there is oversight and a bunch of mechanics around that. But the idea, another example was Yellow House in Middlebury, which was funded by parents. There are a few of these sites that have been funded by parents who happen to have both the intellectual, financial, and temporal means to start them. Mm-hmm. Not everybody has the ability, those 3 resources to start them. And so there is an unmet demand for more alternatives. I think there's a broad recognition that we may have overused or overused shared living as a model because it is relatively cheap and effective. But there are downsides to some people, like the discontinuity of residents and community.
Yeah, and aging out of some of the.
Yes.
Yeah, so, and we would hear from Yellow House and others regarding that model, so.
So can you answer that? So you see that position is really work that can proceed and is complementary or supportive of the planning.
Yes, and I'm agnostic
I
about.
want you to answer Senator Sears' question about why is the position to sort of develop the housing occurring before the planning?
I think it was the idea that this position would be a consultant technical assistant to a group of people to say, if you want to start something, what does it look like? How would you get your business plan together? How would you acquire a site? How would you access subsidized housing funds and to provide support to that? That was the discussion that I heard. Is that helpful? Does that answer the question, Senator?
I think so. I think, in other words, the title is program developer. So you're really talking about whose job is the development of these residential alternatives that are talked about, whether it might be, sometimes it's a single individual and it's able to live in an apartment versus several people or, whatever. So Senator Sears, you have
It answers the question, but I guess I'm still perplexed by whether or not what direction we're moving in. The people who've contacted me seem to want something yesterday, not a year from now. And that's my concern, is that we're just planning something and then, which is not a bad thing, but I'm not sure how far it'll get us. So I'm a little worried about that, but I'm satisfied with the direction. We've got the House Human Services, our Health and Welfare Committee have been through it. It just seemed to me that we had the cart before the horse with that position.
Maybe we're being too literal in terms of what planning constitutes.
Right. Yeah.
It's really design, it's design configuration, right?
And implementation.
And implementation.
Yeah.
Well, thank you.
Developers,
Okay.
start to finish.
Any other comments that you have? This is unusual in the sense that what we're doing is leveraging the money that came in as a result of the bump. On the other hand, this is a system that really, I think, I think got put in place 20 years ago. The shared living is not the desired model for all the reasons that people talked about. So, other questions? Senator Lewis.
I do not have a question, but if you would entertain a motion.
To move the bill?
Yeah.
Okay. All right. Any other questions that we might have? We have a motion to move the bill favorably by Senator Barusa, seconded by Senator Weston. Our clerk will start clerking.
Senator, if I may,
Yes.
there was one other comment that we'd make that was, we've sent this by written comment, specific to the annual quality reviews that were in the last version that we saw. And you may have discussed this already, and I apologize for interjecting, but the language has contained requiring annual reviews in, sorry, I'm scrolling down, in section 8741 on page 6. The Dale on developmental disabilities do not currently do annual on-site quality reviews to all of these agencies because there's inadequate staff. The staff were reduced some number of years ago. And so this would start to feel like an unfunded mandate to say, if we're going to do more quality reviews without the staff capacity to do that, our ask, given that circumstance, would to have that struck. And I'm sorry to interrupt in as you're moving forward with the vote.
No, I think that's important because that ties into a decision we made relative to, we did not, we funded 6 positions. We took the ones that were more administrative, but we also gave some flexibility in terms of how they were used. I gathered the House said, no, we want to take and dedicate them all, or dedicate 5 to the to this programmatic area, which we didn't concur with. So I guess we do need to go back to the decision we made on positions. So what you're saying is, with the positions that got authorized, were that annual review tied into the decision to give 5 positions dedicated just specific to this area? Could you add some?
Is that a question for me, Senator?
Yes, yes.
Yeah, so House Human Services, that was sort of, they originally had them in their conversations and split them out. But I would add, in addition, that our ability to perform annual reviews is limited not only in developmental disabilities, but in choices for care in the brain injury program. So House Human Services, in its attempts to improve oversight in developmental disabilities, because that is one vulnerable population, also left aside the other vulnerable populations similarly situated.
Right.
And that the 5 residential survey and certification positions are not specific to any age group or population. That is all state licensed facilities inclusive of developmental disabilities, older people, people with physical disabilities, brain injury.
And we agreed with that.
And that was what we did was the recommendation on this from Dale.
So I guess I need to be clear, because we want to say all the ones you identified are vulnerable populations, and the resources to do everything for all was a problem. So are you suggesting that and this would have provided greater oversight and review than we have for TBI and we have for the other populations? Would that be the case?
That's correct.
Okay. So I guess the question is whether we need to, we have a annual review requirement that basically, if we're saying we don't want to single out one subset of vulnerable people for this oversight and review and certification, and that's the decision and the change we made. We've got to, well, it says shall perform at least annual on-site quality assurance. That's what you're talking about, to the designated agencies. So the question becomes one of on-site. Are you talking about going out to the individual agencies as opposed to all these housing arrangements? I mean, it seems like an annual visit to, 16 agencies in the course of a year? Is that a problem? Or how are you interpreting it on site?
Thank you for the question. So the current quality review process of an agency is pretty intensive because it looks across all the services provided by that agency, a sample of people throughout that agency, what are called threshold visits. We visit people in their home or residences. So it's a pretty intensive visit. And I think House and Human Services is informed by things we did before staff were reduced in 2008 or so during Challenges for Change or Challenge for Change and Tiger teams. Some of us will remember those days.
Yeah. Unfortunately.
And so essentially we cut the staff in half and went from annual visits to every other year in order to accommodate that staff. And now the other programs have also grown. It's probably not lost on you that Choices for Care has grown substantially from a handful of people with nursing home level of care and residential care homes to close to 600. So at the same time that our capacity has grown down in developmental disabilities, our demand has grown up a lot in Choices for Care and brain injury. So just at least from where I sit, the comparability is not currently there. There are six quality management staff in developmental disabilities. There are also 6 quality management staff in the adult services division. Developmental disability serves a few more people, modest percent more people, but the adult services division has a substantially larger number of providers, including adult days, residential care homes, area agencies on aging, home health agencies, and then things like shared living as well.
So what are you wanting to have that section removed, or what is the current requirement?
Given the date of April 20th, my suggestion to the committee would be to strike that section and perhaps return to it another day, which would mean another year. That section is 8741 about quality service reviews, and it would leave it silent.
And it would just keep the current standards in place?
In all programs, it would leave them untouched for better or worse in developmental disabilities as well as the other programs.
Okay.
Is there a way to put in some kind of analysis or reporting back on what would provide for appropriate quality services reviews? I don't want to make busy work at all, but certainly the concern is that these facilities would have some ongoing oversight. If it's every other year, that's one thing.
Which I think is that the
That's what's
current
happening now.
requirement?
Every other year.
Every other year is the current.
0.
Oh, 0.
Yeah, so something like.
No, sorry, I meant that as okay.
Oh,
Oh, okay.
Awesome.
all right.
So I will leave that to you. This
Well, it's
is-
awfully hard to argue that one group of vulnerable, particularly when you're talking about TBI and you're talking about, somebody who might be a bedridden senior,
some kind of assessment.
right, but what that takes, and you're absolutely right, as we've moved out more of these care arrangements. So if we strike that section, it'll just maintain the current requirement for every 2 years. All right, so.
Is that by rule or guideline? Is that?
What they got for staff.
Yeah, I know, that's the problem.
But sometimes we have standards and then we have trouble meeting them. Is that somewhere, is that a regulation? Is that is there some written reference to that standard?
I believe it's in our state system of care plan.
Okay,
It's incredible. Sorry.
go ahead, Senator Shears.
Thank you. I'm sorry. It's incredible to me. In this budget, we just passed a requirement that kids in placement under DCF be reviewed every 60 days under the family, the new program. But we don't do the same. We don't afford the same type of aid to people who are developmentally disabled, and nursing care, et cetera. It's troubling to me that there is no consistency within the Agency of Human Services. I quite frankly thought the 60-day review was a little bit much, but then I found out it was part of the new federal regulations.
But I think that was only for residential placements though.
Right, but for residential placements. But so somebody who, I realize what you're doing here, but if you're in a residential placement with within a designated agency, aren't you reviewed more than every 2 years?
Well, one would hope that the agency's got some internal quality control review in terms of living arrangements and case managers should certainly, one would think, just like a child in a foster home, a social worker should know that the care is. And
Well, the social worker is supposed to visit every 30 days at a minimum with a child that's not in home placement. I wonder if there are there similar regulations within Dale?
I will jump in. Thank you for the question, Senator. This speaks to a conversation I think I walked in on figuratively when you were talking about conflict-free case management. So case managers are expected to contact somebody every 30 days, and under certain circumstances where things are stable, et cetera, it's every 60 days. But to your point, if this is a separate case management entity, it would be a separate entity in the future monitoring the status of somebody in these residential placements.
Well, I feel better about taking that section out now after having that explanation.
so I think we would, in an ideal world, we would love to do it, but we don't have the staffing resources. And we also are concerned that we would be giving dedicating this level of resources to this subset of vulnerable Vermonters could end up actually compromising and putting other vulnerable Vermonters at risk. Okay. All right. So we have a motion to move the bill, but do you want to amend your motion so that we strike that section?
Absolutely. So I would, when I referenced the amended bill, I would include the amendment of eliminating 8741 quality of services.
All right. Okay, so that was the motion, and I believe Senator Westman seconded it before. I'm sorry, Katie? You have your hand up?
Hi, good afternoon. Just to clarify on your motion, you'd be striking all of section 3 out, not just the one 8741, because the other changes are all conforming changes to create a new subchapter. There are no substantive changes. It's just updating subtitles, chapter names. So we want to just delete section 3.
We want to get rid of the language that says they shall perform at least annual on-site quality assurance.
And I think Katie's just saying that the rest are subservient to that. And if we're getting rid of that, we would get rid of all those sections.
Well, do we want to? I guess is my question.
That starts on page 3 of section 3.
So the reason I structured it that way is to broaden the title, the existing title, so that other topics, broader topics, could fall under that one chapter heading. And in so doing, I had to move the existing chapter into a subchapter and change chapter to subchapter. So if you just got rid of the one section, then you would have essentially a chapter that's been renamed with one subchapter underneath it. It wouldn't be totally logical. So I guess what I'm saying is if you're going to get rid of the one section, you may as well get rid of the whole section 3 because those other changes don't make much sense without 8741.
Those all existing law?
She was just
Well, it's
reformatting.
just changing chapter to subchapter and there's a,
Yeah, they are existing.
Right, it would just go back the way it was.
and assure for unsure.
Right, that changes, hey.
So with that, I guess then what we're talking about is that we would remove section 3 in its entirety.
And renumber.
And yeah. Is that, Katie, that would take care of your concern? Okay. All right. Thank you.
So that would be.
Okay, to move the bill favorably.
Can I ask a question?
Yeah.
I'm sorry, did you, on the appropriations out of the home and community base, did you change those from appropriations to being allocations? Because you have fully appropriated the home and community base in the budget. You don't need to change what you want to spend it on. It just can't be appropriated twice. You would want to change it. So in B on page 6, in fiscal year 23, 120 is allocated.
And same on
From
page 7.
Yeah, and you still leave in the language that you have in 7. So seek to amend it, it's just not referring to appropriations, it's just so you don't double up the appropriations in that consolidated plan. You're specifying what you're gonna use money in that plan for.
All right, so that's a budgetary considerate because we've already appropriated
Yeah, and it's the same thing on page 7, line 12.
Right. So I think we have a motion that will remove section 3. And then we will amend the language in on page 6, line 19 is allocated. Instead of appropriated, and the same would be true on page 7, on line 12, $500,000 is allocated.
And then in the section where updating the plan, you still updating the plan to reflect the allocations made.
All right, so we have quite a bit, Katie, that before we move this, we probably ought to see the amended version.
Sure. I missed Stephanie's very last comment. If she could just email the last one to me.
Sure, it's just in that section 7, I think you're referring back to the appropriations made in sections 4 and 5, and I think you just want to say the allocations made.
Okay, thank you.
Actually, you might not have to, you don't say appropriations, so
No,
I think
you
it's
don't.
fine. You don't have to worry about section 7 at all.
I was gonna say, I don't see appropriation, but sometimes it's there.
So I don't, if you're not saying appropriation, you're fine, you don't have to do anything with section 7.
Okay, so we will, I guess we can wait until we get the amendment and then we will vote it once we have it, and then we'll vote the bill. Thank you, Brad and Jennifer, for being with us and pointing out the need based on the decision we made was to give you great flexibility on the use of those additional resources to address all those different populations, TBI, long-term care, and the IDDS populations. Other questions of the committee on this? Any other things that you want to bring to our attention?
Thank you very much for letting us jump in at kind of the last minute here. We very much appreciate it. Thank you for your time.
Thank you so much.
We did not hear that testimony from Dale when
When you were taking up the
Yeah.
bill. Well, the other thing,
Which is okay.
Senator Lyons was,
Yeah.
we were working on the budget and those positions.
we're
And
fine.
so we have a kind of a timing.
I know.
No, I mean, in terms of two different bills kind of proceeding.
Yeah.
Okay, thank you very much. Well, the next one, I don't think,
Do you want to go to H711?
Yeah.
7-Eleven would be simple.
Yeah.
I should never.
Thank you for joining. I think 711 is the opioid settlement.
I do.
Okay.
Are you the senator? And then they come in to that.
Thank you.
Thank you.
No, you need to hurry.
I have, Jay, I have a question about all these advisory councils and how, when you're looking at the chief prevention officer,
Yeah,
and, what is the relationship? I'm thinking maybe we need to think about, I don't know, how that works better. Some of those predate the creation of the position, and that isn't anything to do necessarily with this bill, but it raises the question about the different advisory commissions and who they're advising and how that fits with that.
sure.
And don't answer it now, but it's
Okay.
sort of,
Yes, we've talked about this in committee. In terms, why don't I talk about 7-Eleven?
yeah, don't even respond to me. I'm just putting it out as something I think we need to think about.
Glad to do it.
Okay, so now we're on to H711, and this has come because of the money coming to the state as a result of the various opioid settlements that have been negotiated with through the Attorney General's office. So we have,
So
how many documents here? Well,
our,
which one should we look at?
I think look at the underlying bill. We have made some changes, some amendments, committee amendments. And we can, I don't think that they are going to significantly affect what we talk about. So the opioid settlement that came to us sometime last summer, I think it was, and,
Well, I like this, they shall cease to exist.
oh yeah, that's the good part of it. No, that's done. So the exact amount of money is about $39 million. I think no one can correct me if I'm wrong, but through the pharmaceutical opioid settlement, we will receive that amount of money. And then there are, in the settlement, there are guidelines and requirements for utilizing the funds, how recommendations for the fund use, the money use, and the period of time over which it can be used. So this bill, so just to go back a little bit further, when the settlement came out, I went through and read it, which is, why would anyone do that? But I did.
Well, you might need clinical intervention.
Yeah. What? No, wait, hold on. We'll get there. We'll get there.
No, I got a problem already. In our budget, we made it clear that prevention and would really be coordinated. And through, and I'm just looking here, seems to be so much department specific.
Okay, so there's a reason for that. So, so going through the settlement requirements, the requirement was that either the expenditure of the funds could take place with recommendations through an executive order or through legislation. Being a legislator, I thought we should start doing something legislatively. And so I met with first the AG's office and then a meeting with Ledge Council, of course, and then a meeting with the administration. And had a couple of meetings with folks, including Monica Hutt, the Chief Prevention Officer, and then also with Jay Johnson, Kendall Smith was there. So it was a meeting in the Pro Tem's office also. So our goal was to understand first, do we do it through executive order or through legislation? And I invited Ann Pugh to come in, and we decided legislation because then we can have greater control over the advisory committee. So one of the requirements in the settlement is that there be an advisory committee established to provide recommendations for the utilization of the funds. That's one. And two, that there be a designated entity that that the money would go through. In this case, it's the Department of Health that's identified here. So the advisory committee that you see listed there is the result of the work that the House did. I knew how busy we were going to be, and so Representative Pugh was kind enough to take the lead on this. And so you'll see a list of folks who are now considered that advisory committee, only for the recommendations associated for the use of the opioid settlement fund.
And to comply with the requirements of the settlement agreement.
Exactly, and so the list that you see for what might be considered for the opioid abatement special fund, we decided it should be a special fund, put the money in one place, and then as it's appropriated, then we'll still have it captured. Then a list of the possible recommendations or uses of the fund. We can't say how it'll be used, but we can suggest prevention, intervention, treatment, recovery, harm reduction, and evaluation activities that might happen and be recommended from the advisory committee. So that's really what you see here. You see the designated agency or entity. You see the advisory council commission, who's in charge, and then the list of suggested recommendations that might be made as the money comes in.
How big is the advisory committee? You've got 7 individuals from the league, an assistant judge.
Yeah.
Why? Why an assistant judge?
I don't know. More of that.
I think that came to us from the House.
I don't understand the
7
connection.
individuals, there are, so the list, go through the full list.
Well, we are, it's down to an assistant judge, and then, of course, the 7 individuals from the League of Cities and Towns.
I would
And
think
that's
you'd,
actually the League of let me just talk a little bit about the League of Cities and Towns. You know,
could you respond to the assistant judge first, please?
Senator, we did not take testimony on the assistant judge. It is something that came to us from the House and we accepted.
Well, there are judges who do courts, drug courts around the state. It would be much, if you wanted somebody from the judiciary, I would suggest that person or one of those persons who actually deals with drug courts, appointed by the chief superior judge.
I would be fine with your suggestion as an amendment.
Yeah, assistant judges.
I think Katie McClinn has her hand up.
Yes, Katie, your hand is up.
Thank you. I can't remember the specific rationale for including the judges. I don't know if it came from the AG or if those judges themselves asked to be part of it. But it's the settlement requires that there is an equal balance between individuals on the committee representing state interests and those representing local interests. So the judges are representing a county interest, a local interest. So if that were to be changed, we'd have to make sure that we're guaranteeing a balance between state and
Looking for a
local
county
positions.
official. You're looking for a county official.
Yeah, I'd rather have a county
We don't
sheriff.
have county. We don't have county, which makes it different.
Well, we have county sheriffs.
That'll probably be a better person.
The other, thank you, Katie, for that reminder. I know that there's a lot of juggling and balancing that went on in making decisions, which is why we were careful not to do too much to change some of that balance. So for example, the municipal representatives some of the municipalities in the state were actually involved in the lawsuit that brought us to settlement in the first place. And as we started talking about the legislation, some folks were saying, well, we should just name those towns that had already been involved, but we decided it would be better to have it municipalities chosen from PLCT and others. So the whole set of guidelines that are and settlement requirements really do dictate how much balance is involved in the advisory committee, and then how the money can be utilized. Which does handcuff everyone a little bit. So when you start asking questions, we have to go back to that original settlement, and the AG's office is probably the best person to talk about because it's a fairly complicated role.
So,
Is the AG is a member appointed by the AG on this
The
committee?
AG, I know the AG was not interested in staying engaged in the process.
Thank you.
Okay.
so what you're saying is this was trying a balance of trying to get the state and local as required, and they came up with the best, one of the best local would be a county judge.
Well, they needed.
You know, I'm such a big advisory,
They needed someone from the county.
yeah.
You're right, the sheriff would probably be better.
It seems like the county sheriff is dealing with all kinds of drug-related.
Right.
I think about it.
Or would that satisfy a judicial branch requirement?
Judicial branch.
Yeah, I'm thinking that is probably one of the.
I guess the question is, how much do we want to second guess, this very large advisory group and what's included? It just struck us as somewhat unusual, I guess.
Because that person really has no.
Depends on who the assistant
Depends who they
judge
are.
is,
Yes.
One might hope that they would have someone who has a background either in law enforcement or an attorney or something like that. Katie? Yes, Katie.
I just sent out a quick email to Josh Diamond, the AG's office, who was helpful in putting this piece of legislation together to refresh my memory of where that position came from. And he reminded me that they asked for a seat in exchange for signing over their payments to the abatement fund.
I see. Oh, all right. So that, I guess that,
That takes care of it.
okay. Thank you.
Yes, I remember that.
Okay, thank you very
Look at my
much.
notes.
Because so many states have county
I
structures.
know, this was one of we have that ongoing problem.
Okay. All right, so what we have here, and the reason it's coming here, it's creating an advisory committee, and then we are going to have to pay the legislators who are on here.
Others.
I think it comes out of the fund.
Oh, it does?
Yeah.
Yeah. It's self-contained.
Okay, so pay the administrative and other expenses related pursuant to in anticipation of receipts.
It doesn't start till next year.
I didn't do it with snow, but it'd probably be in the $10,000 range or less.
And it's pursuant to 18 VSA is you don't get paid if you're already getting paid.
Yeah, when I count them, I only count people that are doing it outside of their jobs, so I pay them.
Okay, which would be like the maybe 2 individuals who've experienced addiction or recovery, those community members. All right, but this would, so the Department of Health would pay and then get reimbursed from the fund? Is that how it would work?
It's my understanding, it says it would come out of the fund, so,
Yeah.
wait, how they get it, I don't know.
Where does it say it comes out of the fund?
It says it's just looking at it.
That's in anticipation of receipts.
Right, so it comes
The
out,
payment shall be appropriate, shall be appropriated from the opioid abatement special fund, so it creates a special fund. And this money would come out.
What page, section are you?
I'm looking at the as passed by House, unless you changed it, it would be like on page 6. So G1.
Okay, so they shall be entitled to per diem compensation of reimbursement for not more than 6 meetings a year. Alice will like that, it's got a limit, and the payments will be paid. All right, thank you.
Thank you.
Okay, so, it's not as though it's gonna be covered and, all right. So, and then you have an amendment here to the House, bill,
yeah,
but it really,
so, our amendment really is designed the bill.
so you
Page 4 is the first instance of amendment, and that's really naming the Substance Misuse Oversight Prevention and Advisory Council by its appropriate name.
right.
And then page 7. Mass doesn't let you.
So I was just wondering, you obviously are amending the language in the House bill.
Yes.
What
And
do
the
they leave out
second
or?
amendment is the definition of where the money, all abatement accounts. We're gonna have, on this one, this is really from, this section comes from the AG's office to define where the money comes from. And we have another a subsequent amendment that we're gonna put on that, as well as another section that has the same wording later on.
So your amendment here is
It's really
being done
technical.
to reflect a recommendation that you received from the.
Yes, and the monies that could be utilized within the fund itself, where they're coming from.
That must be utilized exclusively for prevention, intervention,
Yes.
treatment. Okay.
Yeah. And then the sunset language on page 13 of the bill. Exactly what that one says.
And shall exist on written certification.
So this is just, it is a second sentence that's added. Katie, remind me of the second sentence on the sunset for our proposal amendment. Section two.
It looks like you're starting shall cease to exist
It's just
upon
a
blah,
sentence.
blah, blah. So you've changed the sequence of the
Right.
text here and added a little bit.
We just added a little bit on the settlement fund.
But you're basically, your first sentence is you shall cease to exist upon written certification, as opposed to, is it a rewrite or is there a substantive change here, Kate?
It's just a conforming change with the other 2 instances of amendment to list all the different types of funds. So it might be restructured, but the only change is to update the funds to reflect the fact that since it's come over from the House, the Sackler-Purdue settlement has been underway and they needed additional language to capture the different types of funds that would be moving through this special fund.
All right, thank you. Thank you.
And that's related to the first change that, on page 7.
That Josh Diamond recommended.
Yes. Right, because we're gonna be getting money coming in and maybe getting from different sources, and this will allow for all that money to go into one place for settlement opioids.
Any other questions? Otherwise, obviously, this is activity that's required by the settlement and is being paid for out of the monies received from the settlement. So
What's the amount again? 31 million?
39, I think 39.
39.
So do I have a motion to move the bill favorably? Okay, Senator Baruch, seconded by Senator Starr.
So the good news about this one is that I know that our committee was thinking that we were unable to do a significant amount on opioid prevention, treatment, intervention, and so on, recovery. But this will allow for us to do that. And so I noticed in the budget that there's a potential for utilizing this money. And I think that's really good to keep it on the front burner.
We were trying to link the fact that we have revenues very soon to come in that will support this activity, both from the settlement as well as from the cannabis excise. So we have a motion to move the bill favorably and seconded. You want to call the roll?
Senator Ballin, Senator Baruch, yes. Senator Nitka,
Yes.
Senator Steers,
Yes, sorry.
Senator Starr, yes. Senator Westman, Senator Kitchen.
Yes.
Okay, 502.
And we need a report. Should be pretty straightforward. It would normally be Richie, but he's not here. So I can do it. Thank you very much, Jen. I
Yes,
realize-
this was short notice on everybody else's bills. So I'm just, but this one is mine.
It's good news.
Yes,
We still have a couple of bills to go through, and one, which is the child advocate bill, and you have several.
we also, the youth council didn't come through you. Or did it?
Reach up, and you've been working with finance on that one. I
Well, we are, because if in fact they have a child benefit
Yeah.
that is more expansive, then it will directly benefit not only Reach Up families, but many other families whose incomes are under whatever, if the income level is, I don't know, 55,000 median income or something like that, then it's really very consistent with welfare reform, and that is how you help families, all families, including and outside the, so that was when we got into healthcare, Dr. Dinosaur, you know, all of those ways that we support children and families. So, yeah, so what they do is, I think, gonna have a nexus here as well. Okay, thank you for coming in. I think 4:30, people need to call it a day, and I'm going to.
Oh, I'm gonna go tell my other.
Senator Bray did bring in the amendment.
Thank you.
I'm going to look at it.
Okay. So it's just so people have it.
So we're gonna
I'm gonna go
adjourn
adjourn for today
Okay.
and go
Thank you, Katie.
live.